Hi, everyone. Welcome to the Ritu Podcast Show. This is season three, episode three, and I am with a very special guest today. Actually, a second time guest, Dr. Gehegan. He was here on my first season, and she's back now with more wonderful insights in what she's been doing since few years. And we'll go deep dive into a little bit with her. But for everyone, for all my viewers, Dr. Corinne Gehegan, she's a board certified podiatrist, and she's also a permanent makeup and jewelry business owner, which we're going to talk more about. And above all, he is one of my best friends. So I think that's one introduction. That's number one for me. But yes, welcome to my show, Corinne, again. And
Thank you. Good
please, can you give
morning.
a little bit of introduction of yourself for my viewers? That'd be great.
Okay, so yes, my name is Corinne, Dr. Gehegan. I have been a podiatrist for 25 years now. Can you believe that, Ritu? I graduated 25 years ago from
I cannot
podiatry college.
believe
Uh,
that. Yes.
yeah, it's yeah. And so my path has wandered a bit. I had decided a few years ago that I was going to take a break from podiatry, possibly permanently, just because I was struggling with the whole health insurance paradigm and the way that it kind of controls the way you practice, and it's not always the way that you desire. So I had sold my practice and I decided to pursue another career, which was permanent makeup. And then I somehow, through a colleague in the permanent makeup industry, had been introduced to jewelry, permanent jewelry. And so now I actually have three small businesses, but yeah, they all bring me joy now. So
Yeah. And when you were talking about it, Dr. Gehagen, I remember our conversations around this as well when you were trying to make that move. And even then, I thought it was a very bold decision for you to make, to have been in podiatry for so many years and decided to leave it behind to do something else that where your heart was. But to be honest, as your best friend, it gives me a little bit of joy that you're back to podiatry, some of it now. But
yeah.
I know that you are doing amazing with your jewelry and permanent makeup business as well. And I think with the permanent makeup, your clinical background, like being a doctor, always is a reassurance for your clients because you are a certified doctor, and it's always uh, you know that confidence builds in the clients to come to you because you obviously know what you're doing. So thank you for that introduction, Dr. Hagan. So I know you talked a little bit about how you got into the the permanent makeup and jewelry from podiatry. But if we go back then when you just started, what drew you to podiatry, Dr. Gehagen? And yeah, what would be that one advice that you would like to share with the viewers about foot care?
Okay, so I was introduced to podiatry a long time ago while I was taking my pre-medical courses at New York University. So I went to NYU for undergrad and I wanted to be in healthcare. And what happened was I decided maybe halfway through to obtain a job in the healthcare industry as I was going to school. So I went to the NYU office for student employment. And back then there was a cork board with index cards, and push pins.
Yeah.
And I went to the healthcare category and I just wrote down, all the information because back then you didn't have a cell phone to just take a picture. So
Yeah.
everything was
Yes.
old school. And,
Yes.
I made a few phone calls. I applied to a few of those opportunities, and a podiatrist responded to me, a brilliant podiatrist. He was the whole reason why I became a podiatrist to begin with.
Mm-hmm.
And
Mm-hmm.
so I began working for him both in the administration aspect and assisting him as well. So that I
Yeah.
didn't know anything about podiatry, didn't know anything about feet,
Mm-hmm.
but he had encouraged me to pursue a career in that field. And I felt I had worked for him for almost 2 years, so I had felt that I had adequate exposure. He
Right.
seemed happy, his patients seemed happy.
Mm-hmm.
And so that was how the podiatry career was conceived.
Mm-hmm. Mm-hmm.
Yeah.
And what about an advice you would like to give
So,
for the viewers? Yeah, that's a vague, vast question, but
it's a
just
big,
for
yeah,
just,
there's a lot there. But I will say,
yeah,
I completed a 3-year residency training at University Hospital in Newark
right.
after podiatry school. And my residency director always said, remember, doc, the foot is attached to a person.
Mm-hmm.
So it's always important for myself when I'm assessing a patient to remember that, that foot does belong to somebody. So it's,
Yeah.
always important. What's going on in your feet could, it might not just be directly coming from the foot. It could be something systemic. It could be
Mm-hmm.
something coming from, anatomy or physiology above the foot, be
Mm-hmm.
coming from something
Mm-hmm.
external like footwear. So it's
Yeah.
always important to really try to evaluate all possible factors when you're having a foot issue. This way you
But
could
that's
always,
amazing advice,
well,
Dr.
if you,
Gehegan,
because
right?
I'm always so, you know, wanting to figure out why
Yeah.
condition has manifested and then
Yes.
to
Yes.
therefore prevent it from recurring. So
Yeah.
if you know the root
Yeah.
cause, then you're not always just covering it up with
Yeah. Yeah.
whatever medication or an injection. You're actually trying to find the root cause and then therefore prevent it from occurring again in the future.
Yeah. Isn't that also a life lesson? Not just for food,
It
but
is, it's important not to have
yes.
tunnel vision,
Yes. Yes.
it's, you have to
Yes.
kind of
Yes.
look
Yes.
around, look up, look down,
I know.
Yeah.
And then I can vouch for that, how you've practiced or still practice, Dr. Gehin, because I worked with you for at
Hmm.
least a few years, and yeah, you were great with the patients, and they all loved you so much, and for the right reasons, right? So I totally see where your podiatry treatment or treating the patients is coming from. That vision of like treating not just the foot, but like you said, it's attached to a person. So,
Yeah,
yeah,
exactly. And you were
yeah.
very instrumental in the growth of my practice,
No,
being my
thanks.
very
Thanks, Dr. Geet.
first employee in my life, very first person,
Yes,
my
yes,
office
yes.
manager, and
Yeah,
we were a good team. We
yeah, we were a good team. We really were. I miss those days working
Yeah,
with you,
I
with the
always reflect
patients.
fondly on
Yeah, yeah.
those
Thank
days.
you for saying that. Thank you for saying that, Dr. Geet. All right. So, well, going into the next question of my interview, you're not just a podiatrist, you're also a permanent makeup artist and a permanent jewelry artist. So, how did you make that jump from treating feet medically to creating permanent beauty and sentimental pieces? And I know you talked a little bit about it during your introduction, but yeah, just to go a little bit deeper into how you got introduced to this, that would be great.
Yes, so at the time that I was considering leaving podiatry,
Mm-hmm.
I had spoken to obviously friends, family, my husband, and one evening, myself and 3 girlfriends, all of us being podiatrists, were out to dinner, and I made the
Mm-hmm.
announcement that I'm going to exit the field eventually.
Mm-hmm.
So everyone kind of went around the table thinking about what they would do if
Mm-hmm.
they had decided to leave. And one of my girlfriends had mentioned permanent makeup.
Mm,
And, I was like, that's interesting, and then later on that week, I had researched it a bit. And it seems so different than what I was doing, but actually, there are quite a few parallels. It's an industry where you're doing procedures, and podiatry is also very heavily focused on procedures. So,
mhm.
using my hands.
Yeah.
And the other aspect is working one on one with somebody.
Mhm,
So that was a second similarity. And then, believe it or not, permanent makeup is there's a lot involved scientifically. You
mhm,
have to know the skin anatomy and physiology. You
mhm,
have to know color theory. You have to know your way around different needle configurations.
mhm.
You have to know about skin healing, infection control. There actually is quite a bit going on there, a lot
Mhm.
to think about before you
Yes.
actually select how you're going to go about that particular procedure for that individual, because skin is a living organ and
Mhm.
everybody's skin and behaves differently.
Yep.
So I really enjoyed those parallels.
Yeah, because it is still uh, treating it's still treating someone, right?
Mhm.
And like you said, it involves knowing the skin physiology, anatomy, and you're using needles, so making sure that it's done appropriately without causing any harm, right? So I that's great, Dr.
Mhm.
Gehegan. That's amazing. And I have seen your Instagram posts and the events that you've been to and the people's testimonials and how they've been so happy with the work that you do, especially with permanent makeup.
Mhm.
So that's amazing.
Mhm.
This is really great. And of course, jewelry too, the permanent jewelry. And ever since, how, Dr. Gehegan, once you know about something, you kind of see that everywhere, right? So once you told me about it, I used to see people with permanent jewelry all the time, and I used to think, oh my God, Dr. Gehegan, this is what she does. This is like permanent jewelry, and those pieces look really great, because they're really, um, they really hug to to your wrist or your
Yeah.
neck. So they look different and they look personal. So for
Well,
sure,
that's the fun part. The
yeah, yeah.
client is the designer. And
Oh,
then,
really?
yeah,
Yeah.
the client can
Okay.
design the piece, and so you're kind of watching that whole process and helping
Yeah.
them along. And then again, I'm using my hands to micro weld and put it all together. And so, you know, again, another procedure oriented industry,
Yeah.
but with the makeup and the jewelry, it's that extra layer of creativity and
Yes.
artistry
Yes.
that is something that you don't always get with the medical industry.
That's
You
true. I agree, Dr. Hagen. Also, your personality, Corinne, you're such a people's person. So when you come to businesses like these, like makeup and jewelry, it's really personal for people, right? So if you know the if you I think you try to know the person a little bit by some conversation,
Oh,
and then
sure.
it just helps you to make or give them what they are asking for, right? So
Right.
I think your personality is a big part of it too. That's what I feel because I've known you for I don't know how many years.
Yeah, right.
Yes,
Since
yes.
2007. Almost next year's our 20-year anniversary.
Oh my God.
Can
We have
you
to do
imagine?
something.
Right? Yeah.
Yeah, but it's been it's an honor knowing you, Corinne, not just as a friend, but as a person and as a professional. Everything that you do and your thought process, it's just inspiring to me. So thank you for sharing that for my viewers too. So what my next question was going to be was around your jewelry business is if you can share the most unforgettable jewelry event or a meaningful reaction you've ever gotten from a client after a makeup or a jewelry session? Like, is there one story that always stays with you, something that has happened in past few years that you've been doing this now?
Well, I mean, I've had people message me saying, oh, you've changed my life. Now,
Well, amazing. Yeah.
people might think, how does one change somebody's life with eyebrows? But
Yeah.
the eyebrows frame the face,
Yeah.
and it draws attention to the eyes. And eye contact is so critical in communication. So
Mm-hmm.
I just think,
Mm-hmm.
it gives people confidence.
Yeah.
And it's just nice because it's like an effortless way to feel a little bit glamorous,
Mm-hmm.
So with all the things that I do, it's kind of my goal is basically to keep people active and give them easy solutions.
Yes.
That's,
Yes.
I want to keep people on their feet, people who are busy, let them wake up in the morning. They already look polished. Same thing with the jewelry. You don't have to ask your husband or your kids to like help you with the class. It's just like you get up and go. You have a nice,
Mm,
elegant piece, or maybe two or three elegant pieces that are just always, on you. You
yeah.
don't feel them, they're just you get up and go.
Yeah.
So that's my goal for people.
Yeah. And that makes sense, Corinne. I think that does because, like you said, confidence. I think that's the key word here.
Hmm.
Everyone, we all have some sort of, I would not call it an insecurity per se, but anything that is we perceive as a flaw, either in our appearance or anything. And if there isn't an easy solution to that, then why not do it? I mean, why would you let your light eyebrow come in the way of your confidence when there is a way to go and fix that, right?
Right.
So I definitely resonate with that. Thank you for sharing that.
Yeah, and it's
That's
just,
really
the
awesome.
idea is to enhance what you have, or maybe what you had,
Yeah,
you
yeah,
just, yeah, you just
exactly.
try, it's just like
Yeah.
an enhancement, you know.
Yeah, you won't even call it a flaw. It's just
Right,
you just make it look better than it already is, right? So
right,
for sure. Yeah.
exactly,
Yeah. Yeah.
exactly.
That's great. That's really exciting. I mean,
It's fun. I love to see the transformation.
okay. So I think I did not say that in your introduction, but for my viewers, Corinne is also an avid runner. And Corinne, I know that I reached out to you about this podcast after I saw one of your posts running in like frigid weather outside, cold. And I saw that post and I was like, oh, MG. I mean, I've known you forever and I know you have ran all your life. But that day it struck me that how that really is your passion too. And we really didn't talk about it in our previous podcast. And I really want to dive a little bit deeper with that. So for my next question, I want to know, you're known for running no matter the weather. What is it about pushing through rain, snow, heat, or cold that keeps you coming back? And how has running shaped the way you think about pain or discipline in other parts of your life?
Well, there is a saying, do something uncomfortable every day. So sometimes running, even for me, I've been at it for such a long time. It can be difficult. It is uncomfortable. But for me, the goal with running is has so many layers or multiple goals. There is the aspect, okay, maintaining weight, but it's so much more than that. It's um, maintaining health, because you could be an appropriate weight, but you may not be healthy. So,
Mm-hmm.
it's great for cardiovascular health. It's great for muscle mass, bone density, circulation. So it's that, but it's also for me a connection to nature because I always run outdoors. And yes, the weather may be frigid, it may be extremely hot and humid, but it's a way for me to connect with nature, to enjoy all four seasons. I appreciate all four seasons. And it's also a way for me to set the tone for the day. While
Mm,
I'm running, I will reflect on the previous day or week. I'll plan for the upcoming week. And it just gives me a lot of energy and just time with myself. So that is why I do it no matter what. It's just a discipline, but I do enjoy it. And I always feel, there are people who work outdoors 8 hours a day, so if they can be exposed to unpleasant weather all day long, why can't I just do it for an hour?
Mm-hmm.
So I always
Mm-hmm.
think about others, who are enduring something for even a much longer period of time. And, that also keeps me going.
That's amazing. That's so amazing, Corinne. Yeah, I look at you, I look at your posts, and I'm like, that's one thing Corinne I have never seen you not do. You always have that. So thanks for sharing that. And usually you say you do it every day for an hour, or it's like a
Yes, I
fixed,
would
yeah,
say definitely maybe 5 to 6 days a week. Uh,
right.
1 hour is generally the average, so that could be
Mm,
maybe 7 miles.
okay.
Um, and yeah, it's
Seven
just
miles.
amazing
7 miles
because
every day. Wow. That's
it's
incredible. That's really incredible.
but I just it's just my
Yeah.
my thing,
Something that you do. Yeah.
Yeah,
Yeah. Yeah. Thank you for sharing that.
sure.
That's really inspiring and motivating. I need to go out and start walking. I will.
Yeah, and it's
Starting
a
today.
great way to I take a lot of photos. I see,
Yeah.
you know, beautiful things while I'm out there.
Hmm.
And
Yeah.
so just keep adding to my photo collection.
Yeah. Those are amazing, by the way, also. You are a good photographer. So, mhm, related to your running, Corinne, next question is, as a podiatrist, you run in every condition. What's the most common running related foot injury you treat? And what's one quick tip you give runners to prevent it?
Okay, so a lot of times running injuries are caused by doing too much too soon,
Mm,
which happens quite a bit as the weather starts to become better. We were talking about weather before.
yeah,
And,
yeah,
naturally people tend to want to be outdoors when the weather is nice.
yeah.
But, doing too many miles too soon,
Mm,
or picking up a pace that's a little bit too quick,
right.
those would be a reason. And also the wrong sneaker. There are
Mm-hmm.
so many sneakers out there, and
Right.
if it does not have the proper structure, that the sneaker could be the downfall
Yeah.
for an individual. But I'd say probably the most common condition, one of the most common conditions would be plantar fasciitis,
Mm-hmm.
which is heel pain
Yeah.
that people often feel when they first get out of bed in the morning, or if they've been sitting for a prolonged period of time and then they
Mm.
get up to walk, it will manifest. So
Mm.
uh, that is one of the top complaints. And it's
Mm.
not just a running related condition. But
Mm.
again, it often comes back to the root of the problem being footwear,
Yeah.
footwear that is
Oh, okay.
just not structurally sound or
Mm-hmm.
just overuse or combination of both.
Right. So, what's the best way to choose a sneaker, Dr. Gehegan? Like, if you, so would it matter if you plan to run with them or walk with them, or like, how would you choose the
So
perfect one?
basically, you would want a shoe or sneaker that has structure, meaning that it should pass what we call the taco test. If
Hmm.
you can fold the sneaker in half, then that is a bad sign. This,
Oh,
the
wow.
sneaker or the shoe should bend where the toes bend. The material should be soft where the toes bend because our toes need to have freedom of movement.
I
But
see.
if it bends more in the center where the arch is, if you could actually literally fold the shoe in half,
Hmm.
that is going to be a problem. And
Hmm.
also,
Wow.
if the heel counter, which is the part of the shoe that hugs the heel, if
Hmm.
that is also soft and could be just be folded up like a napkin,
Wow.
that is also a dangerous feature. The heel
Hmm.
counter should be firm. It should
Hmm.
cradle and support the heel all around on all sides.
I see.
So obviously, flip-flops would be a very bad choice to
Yes.
do any degree of walking in.
Yes.
But you'd be surprised how many sneakers out there are marketed for high performance activities, and
Yes.
they are very flexible with minimal to no support. So
Mm.
that is dangerous.
Well, that's very good advice because
Hmm.
I did not know about the taco test.
Yeah, the
So
taco test.
no, I
Yeah.
mean, we like I have boys and like and even when I look for sneakers for myself, you never think about these things. So thank you for
Hmm.
telling. Hopefully that'll help my viewers to select good pair of sneakers for them if they're planning
Yeah,
to do outdoor activity. Thank you for that, uh,
sure.
Corinne. That was amazing. Sorry, I keep switching between Dr. Gehegan and Corinne because I've known you for like many, many
Corinne
years.
is
You're one of my
perfectly
best
fine. Of
friends.
course, Red too. We've known each other for 20 years.
Yes, yes, yes. I know it took me a while to come from Dr. Gehegan to Corinne too. I remember that time.
Oh.
Well, so my last question, Corinne, is that you also volunteer to support the youth at risk.
Hmm.
So what drew you to that work? And looking back at everything you do, podiatry, permanent beauty, running, helping the youth at risk, what's one piece of advice you'd give your younger self about living a life full of purpose and helping others? And before you even answer that, Corinne, I want to know what drew you to start that work and how long have you been doing that?
So I've been doing that for several years. As you know, I have two children. My daughter
Yes.
is 18 and my son will be 14 next month.
Wow.
Um, so once they became a bit older and more independent, I felt that I had some time to devote outside of my family.
Mm-hmm.
And, it's a commitment that it's a few hours a month. The idea is to meet with the teenager for about 2 hours every other week. And
Mm.
just, you know, you could do just simply take a walk. You can go, out to eat there, however you want to spend the time. And
Mm.
it's just, about listening and maybe providing some, guidance, not taking place of the individual's mother or father, but
Yeah.
just some kind of guidance by
Mm.
setting an example of how I use my time.
Right.
And so I feel that, there's another saying, if you want to get something done, ask a busy person.
Yep.
Because busy people tend to, you know, people who get a lot of things done, they sometimes can also take on another
Yeah.
another responsibility. There's always a way to squeeze in a little bit of time because
Right.
think about
Right.
it.
Yeah.
Let's say we all sleep maybe 6, 7, or 8 hours a night.
Right.
That leaves quite a bit of time while you're awake to get things done.
Yeah.
Think
Yeah.
about, most of us can be awake for what, maybe 16 hours a day. 16 hours is a lot of time.
Yeah.
So, I always think about that. I put that in perspective. It's like maybe we work for 8 to 10 hours. And then, of course, there's our children, there's housework, socializing. But
Yeah.
I felt like at that point in my life a few years ago, I can squeeze in a few hours a month
Yeah.
to devote to somebody, who could maybe um, use some advice or just somebody there who can listen to
That's
what they have to
incredible,
say.
Corinne. It's really, and I know that at least you and I have discussed about this one person that you were, uh, you know, uh, guiding or mentoring,
Hmm.
and it's really I can imagine how much uh, satisfaction or, sense of purpose it might feel for you to
Mhm.
be some sort of um, person in that person's life, right? Guiding them, being spending time with them, making them feel
Mhm.
important. I think that's amazing. That's really, really great work that you're doing, Corinne, and I'm so proud to be your friend. Really,
Aw.
I am.
Yeah, it's a great way to
So
help build confidence in an
yes,
individual who may be
yes.
lacking that.
Yeah. And like
Yeah.
you said, they all live with their parents and families, but sometimes, especially at that age, they don't want to hear to their family, right? So if it's this other person, of your stature who's, he's a successful professional and, if it comes from them, any piece of advice, it always is more impactful than like their own
Yeah.
family, I feel. And they feel supported and, they could be, uh distracted or may go to a wrong path, but
Mhm.
then it's always, I think that it's with you talking to them, maybe something clicks with them and they
Right.
choose to look at life differently, right? So
Right.
that's really amazing work, great work. Thank you, Corinne, for sharing that, and I'm so glad that we're able to talk about it today. So, well, that's bringing us to the top of our hour. So I just want to thank you so much for coming to the show today again. And I want to bring you back again and again because having known you, I'm sure you'll achieve more accolades and milestones that we will talk about in coming years. So again, thanks, Kareem, for coming in.
Thank you, Ritu.
Thank you. I am going to share your Insta handle for my viewers if they want to come and check you out, your podiatry practice, or your permanent makeup and jewelry business, so that they can learn more about you and what you do. So yeah, thank you.
All right, Ritu. Enjoy the day.
Yes, and I will talk to you soon. Have a
Of
great day.
course.
Bye.
Looking
Bye, Dr.
forward.
Gehegan. All righty.
Bye-bye.